What's on your playlist right now?
In my class.
Go to guilty pleasure food.
Ice cream.
Ice cream.
Hi, my name's Ijeoma. I'm originally from Georgia, and I'm currently a third-year MD Ph.D. student here at UC Davis, studying the intersection between medicine, public health sciences, and health informatics. I was fortunate enough to co-found an app called Birth by Us, which is a digital health platform focused on advancing perinatal health equity, and we've been honored to support moms across the U.S. and share our work on national stages. I'm currently conducting research in Dr. Susan Brown's lab on digital health tools and AI-driven maternal health interventions, with an emphasis on developing solutions that empower patients, support clinical decision-making processes, as well as personalized care. My goal is to translate research into scalable solutions that reduce disparities, empower patients and families, as well as in the future, hopefully advance the field of maternal fetal medicine.
Hi, Ijeoma. Welcome to Face to Face.
Hi, it's great to be here.
Thank you for doing this for us. Good to have you. I'm going to start with, we have something in common. We both came from Georgia to UC Davis. I understand why I did it, but I want to ask, why did you do it, and how did that happen?
Yeah, well, I feel like I took a trip around the U.S. a little bit. So I was born and raised in Georgia, decided to do my undergrad up in Providence, Rhode Island at Brown, and then I made my way to UC Berkeley because they had a maternal child and adolescent health program that is within the public health department, and I really was focused on that area. So I made the trek from Brown to California, and then during my time there, I was actually applying to medical school, and while doing my interviews, I really made it a point to talk about my work with Birth by Us and maternal health equity, and it seemed like UC Davis was the most excited and supportive about that journey, and so made a decision to move myself to Sacramento, and it's been amazing so far.
I just learned we have another contact point in common. I was a student at UC Berkeley way back in the Stone Age, so we've had a lot of parallels here. Talk a little bit about what you do, what Birth by Us is, and how you get the federal funding that's needed to keep the project going, and why that's important.
Yeah, so a couple of things. So Birth by Us is an application created essentially with the community, with moms. It started out with focus groups with moms where we sat down with them and asked them, we know that you're experiencing all these different complications during pregnancy and postpartum. What would you like to see happen? What tool would you like to have in your pocket? And with those conversations sprouted Birth by Us in a different form, and then we had additional focus groups and conversations to create what we have now, which is a tool to empower patients to lead those conversations and feel more confident going into their appointments, as well as how to check in with themselves after leaving the hospital with their newborn and detect signs of any concerns and when it's time to actually go back and seek more care. So that's Birth by Us in terms of the federal funding. So currently we are on a HSS grant with a nonprofit and SF. So that's been really nice to collaborate with nonprofits to be able to drive this mission forward. But beyond that, it's been a lot of support from people who have supported us along the way through grants or even pitch competitions here at UC Davis as well. So I think that has been amazing. And then lastly, and me in particular, I think federal funding has been really a pinnacle in terms of my career as someone's going into medicine and also research, and the mentorship that I'm receiving from Dr. Brown and also Dr. Rosenthal, and their time that they have been dedicating to me and my profession and my training. I can't, I feel like no money in the world can replace what they've done for me so far, but unfortunately, through all the cuts that have been happening, I did lose some of my funding there, but it's been really helpful to still have amazing people in my corner to see what's next and what we can apply to next. Yeah.
And you're an MD, Ph.D., which is pretty rare and exceptional, I think.
Oh, thank you.
And so that's also requires some additional support, I think, right? So
Yeah,
um,
yeah.
and have you been finding some willing partners outside of the federal support?
So, in terms of the financial aspect of it, we're
Yeah.
still, as you know, this
Still
is still
working.
new. We're
Yeah.
still working things out, smoothing the road ahead of us that we know it's a little bumpier than we expected. But beyond there, some organizations that have been really supportive along the way. I mean, UC Berkeley, of course, UC Davis, and the different aspects. Fund 2 Foundation, which is, they really made a mission to push forward maternal health equity innovations this past year in particular. And then even the Sacramento Kings has been really supportive as well. And then the Wesley Foundation. So we've had a lot of different people in our corners, and people I'm probably not even talking about currently, but that have really believed in our mission, and I'm just very thankful of it. Yeah.
That's great to hear. I'll give you another kudo. You in 2024, you were named as 40 under in the 40 under 40 leaders in minority health list because of the app. Tell me about how that made you feel, and then talk about the app and how it fills a gap for pregnant women or women that have recently given birth.
Yeah, it's interesting to be recognized in that way. I think it's still something I'm trying to get comfortable with as probably so many accolades. There's each one means differently in terms of progress forward, or even just a spotlight of the mission that you've dedicated your life to. In terms of birth by us and in terms of what gap we fill, currently our job is to build with the community. So identify the gap that moms see that's currently existing, and pair that with what is currently supported by literature and seeing if there's synergy there. So one particular gap that we have really been focused on is in the postpartum period. So as you probably know, after you give birth, you leave the hospital and you only have a 6-week checkup appointment, and that's if staffing is up to par. That's if you are able to get an appointment within those 6 weeks, and that you don't have babies to take care of at home, and that all your schedule aligns perfectly. And as you can imagine, people who may not have a babysitter or may not have transportation or may not have the best relationship with their provider may think that they don't need to go to that appointment, or they push that appointment a little bit farther along the way, and it takes even longer for them to seek care, ask for help, have their signs even be identified earlier on, leading to long comorbidities for mothers and even their children. So what we do is essentially we empower them to, one, understand their health. So know when if you're feeling sad 5 days out of 7, it's time to go talk to someone. And it's also time to realize this is not normal. I think a lot of things that we've talked to with moms is trying to reveal the complexity of what is pregnancy and the hormones and the ups and downs that come with growing a baby, and then also what it is, the difference between becoming a new mom and all of the different emotions and realizations and changes in life, transformations that happen afterwards, and how to deal with that. And then there's also element of just patients not always being the biggest advocate for their health. I think when we interact with the healthcare system is when it's the worst time. Yeah. I
mean, there was a really high-profile case, Serena Williams' pregnancy,
exactly.
Right?
Yeah.
And there's some equity issues that need to be addressed
Exactly.
in healthcare, particularly for maternal healthcare, right?
Right. Yeah.
And does Birth by Us try to address some of that?
Exactly, yes. Yeah. So Black women 3 to 4 times more likely to die in childbirth than their white counterparts, and something that Serena Williams even talked about understanding her body and understanding that, I am in high risk of having blood clots and people not listening to her. So there's an element of not being listened to. There's an element of not your pain not being elevated to in comparison to someone who may not look like you. And so what we do is we support them with the data to support and the trends that they have within the application, and also the wordings to describe how they're feeling to physicians or to the provider so that they can get the adequate help that they need at that time.
Yeah. And one of your mentors, advocates, supporters in this work has been Dr. Susan Brown,
Yes,
who you
yes.
mentioned in the intro.
Yep.
Can you talk about what her mentorship has meant to your educational journey?
Yeah, it's meant the world. As you can imagine, like having a mentor in general is great, but having a amazing mentor who sees your potential, who pushes you, who identifies your gaps, and fills in those gaps, is something that I could have only dreamed of. And then I came here and I was able to really connect with Dr. Brown really early on, through the ARC-MD program, which I was before matriculating into the MD PhD program. And because I trusted her and I really bonded with her so well and felt safe and my career safe with her guidance, I decided to extend my years and matriculate into the MD PhD program. So spend a little bit more time here. So her paired with Dr. Rosenthal has been such an amazing team, and I feel like I'm being pushed to the limits that I need to in order to achieve the amazing things that I have in my mind that people imagine but sometimes don't come to fruition. But I think with the support that I have, I can definitely see it through.
So having had that great mentoring experience, has that motivated you to be a mentor yourself to other people that are coming behind?
Absolutely.
Yeah.
I think it's the importance of mentorship is something I'm seeing firsthand. Beyond just like the knowledge, just the environment, being safe, even as a Black woman in this space as well. And so I've really seen it in a different light coming into Davis, and it's been amazing. Yeah.
Do you have any advice you would give to someone who wants to follow in your footsteps?
Oh yeah. I would say don't wait. I would say, identify the things that you're really passionate about and that gets you up at 3 o'clock in the morning. People always say 5, but I think 3 because that's when you're really having your deep thoughts. And make sure that you have people around you that see your vision beyond what you're even imagining, so they can, one, stop you when you're going a little too fast, but also push you to grow in ways that you didn't even think about. So I would say having great people in your corner, knowing what you're really truly passionate about, and honestly, like not giving up. I think that's the biggest thing.
I would co-sign all 3 of those things. I know you have a couple more years to go in your program before you finish the degree, but have you thought about your aspirations for your career longer term? What do you want to do in, say, 5-10 years?
Yeah, I think it's always in flux, but the core is surrounded about health equity, innovation. I do want to continue to innovate in digital health and technology. I do want to understand how to really pair the innovation aspect of my thinking in medicine. Before I would say that I want to go into maternal fetal medicine and see how ways we can innovate into in that space. And I think that as I continue to go through these processes, I kind of go back and forth between how to become like a mentor, a professor, as well as having clinical work, and also being in the industry and innovating and seeing if there is a pathway forward where I can have all 3 arms, but obviously have somewhat of a balance. So aspirational, and everything has a timeline, but I definitely see myself as continuously innovating in this space in my different hats.
Well, it's great that you've been thinking it through and do make some time for yourself and all those things that you want to do aspirationally. It's important to have that balance. Yeah. So we have a feature on this face-to-face show we call it Hot Seat. Oh. You're on the hot seat.
Okay.
It's not that bad. All we want to do is ask you some questions, sort of rapid-fire questions, and just looking for like a one-word or one-sentence answer.
Yeah, perfect.
You ready?
Yes.
All right, here we go. Favorite spot to vacation?
Oh, if I do vacation, my last vacation was I went to Nice and I loved it, so I'll say Nice.
Nice.
Yes.
Oh, I have enjoyed Nice as well. That's a good choice. Yeah. Favorite way to relax or unwind?
I would say walking the park with my dog.
Okay.
Yeah.
Dog lover.
Yeah.
What kind of dog do you have?
I have a mini golden doodle.
Okay.
Yeah, his name is Theo.
Theo. Okay. If you could meet anyone, alive or not, who would it be and why?
Oh wow, this is a hard question. Oh my gosh. You mentioned Serena Williams, and she's actually on my list, so I'm going to stick with her.
Okay, that's a good choice. Yeah. My wife likes her a lot too. We'd like to meet her as well.
Awesome.
What's your go-to comfort food?
I'm Nigerian, so I would say fufu.
Fufu?
Yeah, farina.
Yeah, fufu's good.
Yeah.
I ask every guest on the show this. What artist is at the top of your playlist right now?
Oh, that's so hard. It's in flux. Lil Wayne just released an album, and so I've been listening to his album. He's not on the top of my list currently, but he's just an album that has.
This is your
been
Georgia
sprouted.
influence here.
Yeah, I know. But Sade has been the person I always go back to.
Oh, yeah.
Yeah.
Love Sade. I'm
Yeah.
a big fan of Sade. Now it's your turn. You can ask me anything you'd like.
Okay. Oh, wow. What has been the most transformational event in your career so far?
Career-wise, the thing that sort of motivated me the most, a few years ago I got an award from President Obama at the White House, and just the whole experience and visiting the White House and being in the Oval Office and being able to have basically about a 10-minute conversation with the president, that was really one of the top points in my professional career. So I have to go with that.
Awesome. What advice would you give your younger self?
Buy Apple stock.
Fair enough. Fair enough.
No, I'll take it more seriously than that. I would say the one regret I have, but it's not too late to fix, but I would like to learn another language.
Yeah.
So I would tell my younger self to start learning another language before it's too late.
Yeah, awesome. And I guess your favorite restaurant in Davis or Sacramento?
So I have a couple. So in Davis, we like the Mustard Seed. We go there a lot, and that's probably my favorite in Davis. Sacramento, I have many that I like. My wife and I are going to be celebrating our anniversary.
Congratulations.
And, thank you. So we're going to Allura in Sacramento this
Awesome.
weekend. So that's one of my many favorites in Sacramento. Sacramento has a great food scene.
Yeah.
So
That's what I hear.
yeah. Anything else you want to ask?
I feel like I should have been prepared. I have so many questions.
It's fine.
I guess my last question would be, what advice do you have for young professionals who are at the edge of their seat, wanting to be, the leader in whatever field they're in, wanting to innovate and thinking about like entrepreneurship and leveraging their experiences, as you've talked about so many times.
Yeah.
So, what advice would you give, I guess, someone in my position?
We've talked about it a little bit. Finding a mentor is so important.
Yeah.
Mentorship. If you talk to any successful person, they will point to someone or some group of people that were instrumental in them getting the knowledge and resources they need to be successful. So I think you're already on the way with having a good mentor. But I would also say, think about, if you're innovating, think about the customer or the client or the patient in your case, like what they're going to be needing, and involve them in the innovation process as you go along, and not just develop something and give it to them and say, here, use it.
Right.
Think about what their needs are and what their capabilities are and what would really be helpful to the person you're trying to influence or help. So those would be my two pieces of advice for you.
Awesome.
Okay.
Thank you.
Ijeoma, thanks so much for coming on Face to Face. It was a great conversation. Loved having you here. And thanks again to everybody who's watching. We'll see you next time on Face to Face. Go Ags.